Hello, and welcome to the presentation on Navigating Your Benefits, a guide to open enrollment 2017. So this is Andrea Lightfoot, Wellness Program Manager speaking, and you'll see that we have other presenters as we travel throughout our different offices. Just a reminder that we are from the Employee Service Center, which is part of the Finance Department. You can download a copy of this presentation at tinyurl.com/ESC presentation 17. That will give you easy access to all of the slides. And just a reminder that you'll be able to access this presentation and information on the intranet as we go forward. So thank you very much for joining us today for this presentation on open enrollment for 2017. So here in the Employee Service Center, we do quite a few different programs, including all of our benefits. That would include the medical plans and prescription plans, as well as dental, life insurance, short-term disability, and coming soon, our new voluntary benefits, including vision and income protection that we will be talking about today. We also run our employee wellness program, FMLA, which is family medical leave, retirement, and payroll. So the Employee Service Center is physically located in the district office in Building C, room 117. You are always welcome to stop by and visit us in person. However, you can also find us online. If you go to the intranet or to My Pima at work and choose the Employee Service Center and benefits, you'll be able to access a whole lot of information about the Employee Service Center, including all of the benefits and open enrollment materials. You will also be able to find benefits as well as other aspects of the Employee Service Center available on Banner Self-Service. So again, all of that is going to be accessible through My Pima. So today we're really going to talk about what is changing this year as we head into open enrollment. So all of these changes will be effective July 1st of this year. With our medical plans, we are going to talk about some rate changes, but I have some really exciting news to go along with that as well. We are also going to find that our PPO plan will not have additional contributions made to an HRA. We'll talk more about that in a moment. We are introducing a new high deductible health plan, which is in addition to our current plan. So we will now have two of those. And for all of the medical plans, we have some great new plan benefits, including complementary therapies. We're going to look at those in detail as well in a moment. With our dental plans, for the most part, they're going to be staying the same, with the exception of a small increase to our Delta dental rates, but that does come with some enhanced benefits that we will also look at. We're excited to introduce a new voluntary vision plan. We'll give you details on that. And we also will be introducing some new voluntary income protection plan. So we can't talk about benefits and open enrollment without talking about costs. As we know, healthcare costs, unfortunately, across the country do continue to rise, and they also continue to go up in our own healthcare plan unless we manage our chronic conditions and practice prevention. So across the country, we continue to see that rise in cost due to basically unhealthy lifestyles. When conditions aren't properly managed, it costs more for all of us, including out of our own pocketbook, if we develop chronic conditions that aren't well managed. We also find that pharmaceutical costs are continuing to increase. Specialty drugs specifically drive 44% of the college's total pharmacy spend. These are drugs that tend to be quite expensive and treat very specific conditions. We also continue to see the effect of healthcare reform as well as medical innovations. We always want the newest and greatest technology, but that does come with a cost. You'll see a picture here about the cost of insurance, basically everything that we pay on the plan, based on our personal health risks. And no surprise, the more conditions that we have, the more money we have to spend on healthcare. So really, one of the best things that we can do is practice prevention. Of course, we can also work wisely and use the resources available to us to help us manage any chronic conditions. But doing things like taking a health risk assessment, going for our preventive health screenings, whether that is our annual physical or a specialty service like a mammogram, and then practicing healthy eating habits, being active, sleeping, managing stress. All of those are super important to not only our personal health, but also to costs. As a college, we can also work with our coworkers and encourage them to practice these healthy habits as well. Managing chronic conditions is really important. Using the services available through the health plan as well as through health coaching services can be really helpful with managing that. And then we can all do our own homework and look for finding the best, lowest cost for the best quality. So basically shopping around and looking for savings can help all of us with these continually rising healthcare costs. So let's look specifically at our medical plans. As you may be familiar with, because these plans have been offered for a few years at least, we have a PPO plan, Preferred Provider Organization. We have an EPO plan, Exclusive Provider. Then we have a basic high deductible health plan, which is the one that some of you listening today might already have. And we will now have a new additional buy-up high deductible health plan. Both of those high deductible health plans do come with a health savings account. Now, all of these plans, no matter which of the 4 medical plans you choose, you're going to find preventive services covered 100%. They also include a lot of wellness services and discounts. They also are all attached to prescription coverage. And then new this year, we have complementary therapies available on all of our plans. So let's take a look at that. Starting in July, all employees on any of the medical plans have access now to naturopathic services and acupuncture as part of the medical plan. Now, these do need to be performed by a DO, an NMD, an LAC, a licensed acupuncturist, or a chiropractor in order to submit them as a claim. When you're looking at any copay or coinsurance schedule to figure out how much your share is going to be for that service, you're going to go with the specialty care fee schedule. It is important to note that there is a $1,000 limit. So that's going to be what the plan pays. Once the plan pays $1,000 or up to that amount, any additional services will be covered out of your own pocket and not included under the medical plan. One other thing to note is because this is a new service and not something that Blue Cross Blue Shield typically offers, you will need to submit your own claim. So for example, if you go to a licensed acupuncturist and you're on a plan where your copay is $40, you would pay that $40 there, but you would also pay the additional amount that the acupuncturist charged, and then you'd submit that as a claim through Blue Cross Blue Shield and be reimbursed that additional amount. Also added to all of the medical plans are medically necessary bariatric surgery coverage, Botox coverage, and then also transgender services. So again, all of these are available on all the Blue Cross Blue Shield medical plans, regardless of which one you choose. So we're going to take a moment to look at the rates. And really what I want to point out here is that if you are on the PPO or the EPO plans, and you choose to participate in the full Pima Healthy Rewards Program incentive of $500, you will see no increase to your premium for this next year. Otherwise, you'll see that the costs annually are about $240 higher. With the basic high deductible health plan, now that is the one that you may currently have and that we are currently offering. We're just adding the title basic to it. That plan is going to continue at $0 premium for employee only. And then you'll see that low cost amount, just a tiny bit higher for all of the other tiers. And then we have a new buy-up high deductible health plan option. And what you'll find there is that all of the tiers will cost about $500 more than you would pay on the basic high deductible health plan. And we're going to look at each plan separately in a moment so you can get an idea of what that annual premium covers, if you will. Now, in the past, we've talked about the HRA with the PPO. So this is a health reimbursement account specific to the PPO plan. If you currently have an HRA on the PPO, any funds that you have in there are going to roll over. They're not going to go away in the foreseeable future. However, the college will not be making any additional or new contributions going forward after July 1st. So again, if you currently have money in there, it will roll over, but there will not be any new HRA contributions if you're on the PPO. For the high deductible health plans, both of those are paired with a health savings account. For the basic HDHP, again, the one that we currently offer, the HSA contributions stay the same at $750 employee only, $1,500 for employee plus one or more. You might actually get more money this next year if you're earning the full $500 wellness incentive. The buy-up high deductible also offers HSA contributions, and you'll see that there on the bottom right-hand corner as $600 for employee only, and then $1,200 if you have one or more. So let's very briefly review that Pima Healthy Rewards program. Hopefully you have been working throughout the year on your points, because earning the points is going to be what earns you the dollars. So again, you can earn up to $500 towards your medical plan annually. On the EPO and the PPO, this shows up to offset the premium. On the high deductible health plan, either one of those, the money will go straight into your health savings account. Still, again, plenty of time to earn, especially the $260. To do that, you want to earn 9 points in the Healthy Blue portal. So to do that, you need to participate in a health screening. Those are going to be offered on site in a few weeks. You can also obtain a screening at a local laboratory. All those instructions and schedules are available on the intranet. Once you get your results, you can log that you did the screening and take the My Blueprint health assessment at azblue.com, and then complete one local employer activity. So for a list of all those options available to you, you want to go onto the intranet under Employee Service Center Wellness and look at that Pima Healthy Rewards program information for a list. If you want to earn $500, you basically will just choose from a list of additional preventive screenings and or wellness activities to earn that full 20 points, and that will give you $500. A reminder that all steps must be completed by May 31st of this year. That means that you need to log your completion in all of the activities and take the health assessment by May 31st. Again, that's at the azblue.com site under your personal Healthy Blue portal. This program is an annual program, so you'll be able to start earning again July 1st. That program will be very similar with a few little changes and additions, so you can look for more information coming out on that soon. Still talking about costs, I would like to give everyone a reminder of how much the college pays for all of our medical costs. Now, you'll note at the bottom there, the college pays over $10 million in medical benefits, and that's just a medical plan. It doesn't include everything else. Employees pay about $2.5 million. So the college covers the majority of medical expenses for both employees as well as employee plus family plans. Depending on which plan you're looking at, the college covers 86 to 100% of the total premium. And for those on the high deductible plan, the college also puts dollars into that health savings account. If you're also covering family members, the college continues to cover a large portion of those expenses, with 50 to 80% of that total premium covered by the college. So something to keep in mind when we feel like the costs just keep rising, to remember the college really does cover a lot of those costs for us. So we're going to switch a little bit here and talk about each of the medical plans individually. The EPO, or Exclusive Provider Organization, is a little bit different than the others in that it is an in-network only plan. Emergencies may be covered out of network, but otherwise all your services need to be in-network in order to be covered. Now, this plan has a deductible before any of the co-pays. So if you're just starting out July 1, you're going to pay the cost for the services. It is going to be a discounted cost, but you're going to pay the full cost until you reach that deductible. $350 for any individual and up to $700 for a family. Once you've paid that deductible, everything the rest of the year is based on a copay. So it's a specific dollar amount that you know in advance that you will be responsible for paying at the time of service. You'll see this plan, like all our others, has an out-of-pocket maximum. That is your protection level on the plan. So if you pay your deductible and you have a lot of office visits, hospital visits, etc., and you've paid $3,200 for any individual, the college covers the rest of that cost. Your out-of-pocket would be only $3,200 on the medical side, or for a family, $9,600. This plan has a separate out-of-pocket maximum for the prescriptions, and you can see $3,400 or $3,600. We've found that that's quite difficult to meet because our copays are so low, but it's important to note that those copays are counted towards a different out-of-pocket maximum. So let's look at our PPO. Now, preferred provider, meaning that if you go to an in-network provider for your services, you're going to get the best deal. It's going to have the lowest cost for you. Although you certainly can choose to go out of network, you'll just see that the costs are going to be a little bit higher. Today, we're going to focus on the in-network benefits for comparison purposes. So you'll see this plan also has a deductible. However, it's a little bit different. It's not for all services. You only would pay that deductible for any of the services that have co-insurance listed next to them. So on this plan only, if you see a copay amount, the 1st of July, you would go in and just pay the copayment amount. If it says co-insurance on the list, however, you would pay the cost of the service up to the deductible amount, and then that co-insurance amount would kick in. So again, you have an out-of-pocket max. So if any individual paid $2,800, that person would not need to pay any more out of their pocket for the medical side, $5,600 for an individual. Again, you'll find a separate out-of-pocket maximum for the prescription side. So you could reach that $2,800 for an individual, or $5,600 for a family, and still have some additional co-pays throughout the year for your prescription services. So the EPO and the PPO plans are exactly the same as this past year. There are not any changes to those. So let's look at what we're now calling our basic high deductible health plan. So this is the plan that we currently offer. Again, we've just added the name basic to it. This plan also offers in-network and out-of-network services. The out-of-network are going to be quite a bit higher, so we're going to focus on the in-network. You're going to find, again, similar terms such as a plan deductible, out-of-pocket max, and co-insurance. Now, this plan, however, works very differently than any of the other plans we've looked at, especially on the deductible side. So you're going to see it says $1,500 or $3,000 for your plan year deductible. If there's only one person on the plan, your deductible would be $1,500. So you would pay for the cost of your services until you reach that deductible. On this plan, it's not just medical services, but it's also prescription services. So whether you pick up a script or go to the doctor, you're going to pay the discounted cost of the service or medication until you reach that $1,500. If you reach that, anything you need after that is going to be 20% co-insurance. If you had a bad year and a lot of services, the most you would pay would be $6,600. That's your out-of-pocket maximum, your protection level. Again, that is for both medical and prescription, so it's a combined out-of-pocket maximum. You'll see that row is highlighted because the out-of-pocket max did go up a little bit this year. Now, here's a big difference. If you are on this plan, and it's employee plus one or more. So whether it's employee plus spouse, employee plus family, if you have more than one person on the plan, any one person has to meet the full family deductible of $3,000 before the co-insurance kicks in. You could certainly have one person, with a $300, $400 of expenses that would count towards that $3,000. But the other person who has something major occur, you would have to add that up. So that full $3,000 deductible would need to be met before the co-insurance kicked in. The good news is that $6,600 out-of-pocket max for an individual still applies. The family maximum only would apply if more than one person had a lot of services. So if you're on this plan with a family, that one individual, their expenses were $6,600. They would not pay any additional amount for either medical or prescription. However, the rest of the family might continue to have additional expenses, but never more than $13,200. Now we're going to look at the buy-up high deductible plan. So for this plan, you have a couple differences. You're going to see, again, plan year deductible. So once again, you go in for services, you're going to pay the discounted cost for either medical services or prescription services until you meet the deductible. Now that is $3,000 per individual, but also per person, or up to $6,000 for a family. So this deductible is different. In the previous example, on the basic plan, we talked about if there is more than one person on the plan, one individual would have to meet the full family deductible before co-insurance kicked in. But on this plan, any one person would only need to meet that $3,000 per person deductible before co-insurance kicks in. Then if additional family members have expenses, they would also kind of apply in a different bucket and work up potentially to $6,000 for the family. You're going to see on this slide, though, once you reach that deductible, there's no co-insurance. So your services in network are covered 100% after you meet that deductible. So that's another benefit of this plan, and that's why the out-of-pocket maximum is the same as the deductible. So again, you get a little bit of protection built in. So once any individual on the plan reaches that deductible, there will be no additional coinsurance or responsibilities for either medical or prescription. And then if you have more than one person on the plan, the most that you might be responsible for out of pocket is $6,000. So that's what you're paying for, that buy-up option. We're going to take a moment and try and put the plans a little bit side by side for you to take a look at. The first thing we have on the comparison is your premium. So how much are you paying out of your paycheck? And what you'll see is on the basic high deductible, we continue to have that $0 employee-only premium, and you'll find the lowest family premium. So if you're just looking at the cost of the plan, what comes out of your paycheck, that basic high deductible health plan is going to have the lowest premium costs. You'll find that there's kind of lower premiums on both the PPO and the buy-up high deductible plan, and then your highest premium is going to remain on the EPO. Next, we list your coverage, and really here what's important is the EPO plan is in-network only. Everything else is going to be in-network and out-of-network. Then when we look at deductibles, we saw they all work a little bit differently. The PPO plan is going to have a deductible before some of the services, whereas the EPO has a deductible before all of the services. EPO and PPO are the deductible is applicable only for medical services. Then if we switch over to the high deductible plan, again, we're going to have that deductible before all services, but it's going to be both the medical and the prescription. The highest deductible across the board is going to be on your buy-up high deductible plan. Then we look at your out-of-pocket maximums, and you can see all those dollar amounts listed there, individual versus family. Remember, on the high deductible plan, it's a combined out-of-pocket maximum, whereas the PPO and the EPO are going to have a medical out-of-pocket maximum and then a prescription out-of-pocket maximum. The PPO and the EPO plans are the only ones that have co-payments, although the PPO plan also has coinsurance. The basic high deductible has coinsurance after the deductible. If you remember, the buy-up high deductible had no coinsurance after the deductible was met. Then we look at the health savings account, which we're going to talk about more in a moment. The highest contribution from the college is for the basic high deductible, a little bit lower on the buy-up high deductible. We're going to talk today also about flexible spending accounts. So the PPO and the EPO plan, you can continue if you are interested to have a flexible spending account for healthcare. On the high deductible health plans, however, you cannot have that same flexible spending account, but you may choose to have a limited purpose flexible spending account that would just cover dental and vision services. Again, we'll talk about that more in a moment. So as I mentioned, the high deductible health plans are attached to a health savings account. This is a bank account that you own. You can put money in, the college will put money in, and allows you to set aside money pre-tax to use for medical expenses. You can also use it for medical, dental, and vision expenses. However, there are some eligibility rules. Again, all of this is covered by government guidelines. To open and contribute to a health savings account, you must be covered by a high deductible health plan. So obviously you would have that through the college, but you cannot be covered by any other health plan. You also cannot be claimed as a dependent on another person's tax return. You can't be entitled to Medicare, IHS, or TRICARE. You also cannot have received VA benefits in the past 3 months. You also cannot have a healthcare flexible spending account, which we just mentioned, but you might choose to have a limited purpose flexible spending account. Now, this is important if you're considering switching to a high deductible health plan and you currently have a healthcare FSA. If you want to be eligible on July 1st for the high deductible health plan with the health savings account, you want to make sure that your balance in your healthcare FSA is $0 by June 30th. So just some basics on the HSA. Again, you would be automatically enrolled if you're choosing the high deductible health plan, although you may want to choose both the employer contributions and make your own contributions. You will need to activate the card that you get in the mail. It does come with a debit card since it's a bank account. Your funds roll over from year to year. So once money is deposited into that account, it's yours forever. You can use it for qualifying expenses, or you can save it for the future. And if you leave the college, that money is still yours. You are responsible for making sure that you're spending the money for qualifying expenses and keeping all of your receipts should the IRS ever come to you and want to take a look at that. Again, the money is specific to medical, dental, and vision expenses. If you decide to use it for something else, penalties would apply as well as taxes. There is an exception to this, though. Once you reach the age of 65, if you decide you would like to use that money for non-qualified expenses, there's no penalty. You would just pay the taxes on that. Now, the IRS does set a limit on how much money can go into that health savings account every year. It's $3,400 for an individual, $6,750 for a family if you're on a family plan, so one person plus one or more. If you're over age 55, you can contribute an additional $1,000. There is a presentation specifically about high deductible health plans and health savings accounts coming up that will also have a recorded online version. You are welcome to take a look at that, where we really look in depth at these particular plan options. As I mentioned, the college will put money into that health savings account for you. So that will help you if you do have expenses early on in the plan year. The basic continues the contribution of $750 for single, $1,500 for family. Again, family is one plus one or more. And the college is going to continue to front load 1/3 of that up front. So after that first paycheck in July, you get 1/3 of that into your account. On the buy-up high deductible health plan option, the college will contribute $600 for an individual or $1,200 on a family plan. Again, for that plan, 1/3 of that will be front-loaded for you. Remember, if you're doing the Pima Healthy Rewards program, you can earn that full $500, and that amount will also be contributed into your HSA throughout the year. So you can also contribute to that account. Again, all that money is going to be pre-tax. You can choose the amount so it comes out of your paycheck and goes right in there. There are also opportunities within that account to earn interest and or invest the money and earn additional money through your investments. And all of that remains as pre-tax as long as you're using that for qualified expenses. So if you do enroll in this plan, just a quick note on how it works. You would go into your provider or go to the pharmacy. You'd present your high deductible health plan medical card. If you're at a doctor or a facility, they're typically not going to know automatically what your deductible or out-of-pocket balance is, so they're going to send you a bill after they've submitted it to the insurance. However, typically when you're filling a prescription, they're going to be able to check the deductible, out-of-pocket maximum balances immediately and tell you how much you owe right there. So Blue Cross Blue Shield, they provide the deductible balance to the prescription provider, the pharmacy, or the doctor's office. And whether you're paying there or receiving the bill and pay, you can pay with your health savings account, or you can pay any other way and reimburse yourself later. So if you're starting out the year and you don't have a large balance in your health savings account, you can pay with a credit card and then throughout the year reimburse yourself as money is deposited into your health savings account. Again, remember, once you meet that out-of-pocket maximum on either plan, there's no additional expenses for you. I know that's a lot of information on a lot of plans, but we do have a tool available to help you figure out what plan might work best for you. If you visit the intranet and go to our open enrollment page, you can find a benefits calculator. Currently, the old one is up, but the new one is in process for you. It will allow you to compare the plans side by side, enter, for example, how many doctor's visits you think you might have, how many prescriptions you might need to fill, if there's any major medical services you might need. And it will estimate for you at the end of the year how much would that particular plan cost you. It will look at both your total out-of-pocket cost as well as your premium. So you can compare that. Just remember again, plans work differently. So one plan might have a much lower cost depending on a certain scenario, but it might require more money from your pocket earlier in the plan year. So take a look at this on the intranet, play around with it, and use that as a tool to help you choose the medical plan that might be best for you. Remember, I said earlier that all the medical plans are attached to prescription or pharmacy plan. So on the EPO and the PPO, you're going to find co-pays. There are no changes this year, so the current co-pays are going to continue for you. And you have the options of both retail as well as mail order pharmacies. And the diabetic supplies are going to continue to be available at that low copay. Again, either retail or mail order. So remember, on the high deductible health plan, we don't have co-payments. We're paying for the discounted cost of the prescription until we meet the deductible. And then if applicable, we would pay co-insurance after the deductible was met. The only exception to that is, again, the diabetic supplies do have a copay available to you. So to make sure that you are getting the best cost for your prescription, to see if perhaps there's a generic available, or if switching to mail order might save you money compared to retail, you can use the Express Scripts mobile app or online tools to help you check all of that information. On the medical plan side, we have a Blue Cross Blue Shield app, but we also have a whole suite of online tools available to help us. So we can go online to azblue.com and get estimates for healthcare costs. So if you know you might need, for example, a knee surgery or a hip surgery, you can get an estimate through Blue Cross Blue Shield. It will also help you compare different facilities to find the lowest cost facility in your area, because it does differ from location to location. And you can also compare quality as well. Some additional tools available on the medical plan are a nurse on call program. So you can call 24/7 and talk to a nurse. A great benefit that is no cost. We also have discounts available, health and wellness discounts, gym discounts through Blue 365. And then we also have a variety of coaching options. So if you want to work with someone to help get your blood pressure under control, your asthma under control, get more active, there are a suite of both online tools as well as one-on-one health coaching support over the telephone. And again, all of these services are free to all members on the medical plans, regardless of which of the 4 plans you choose. Let's talk now a little bit about the flexible spending accounts. So I've mentioned the healthcare. That is a pre-tax savings opportunity. So it allows you to put aside money pre-tax to use for your healthcare expenses. Again, it's only available for the EPO and the PPO plans. Unless you want a limited purpose FSA for dental and vision, you may choose that for the high deductible health plan. You can elect up to $2,600 put aside pre-tax to use. The full amount of that is available on July 1st. So even though you're contributing money all throughout the year, that full amount that you elect is available to you starting July 1st. You may choose to do a debit card for a small fee, or you can do claim submission through online or fax or snail mail. There's also a dependent care flexible spending account that continues. That allows you to put up to $5,000 pre-tax aside to use for dependent care expenses. You can also use that for elder care or adult daycare. That one is a little bit different in that the reimbursements are available as money is put into the account. So different than your front load on the healthcare FSA, the money on your dependent daycare is going to be put in throughout the year, but that allows you to submit those receipts as you go. Important to note that these are use it or lose it plans. So whatever amount you elect, you must use it all or it will go away. You do have an additional 75 days after the plan year, though, to incur your expenses and a little bit of extra time to make sure your claims are submitted and you have received all of that money back. But another great opportunity to take advantage of for pre-tax savings. Now, if you choose a flexible spending account for either healthcare or dependent care, your traditional way to get your money after July 1st is to submit your receipt and a form to ASI Flex, the provider. And then they will either send you a check, or if you sign up for the direct deposit, they'll reimburse that money directly to you. With the healthcare FSA, you might choose that debit card option, which is very handy. But it doesn't mean that you don't have to submit receipts. Documentation is often required for when you use your debit card. So don't be surprised if you get your card, you use it, and then you get a note saying additional documentation is required. It's really easy though. You just scan it in or mail or fax and let ASI Flex know that that debit card expense was for a qualified expense, and you'll be good to go. We're excited to announce our new voluntary vision plan. That is going to be through AVESIS. So you can go to avesis.com to their website, take a look at the providers, see who's in network. AVESIS will also be at all of our benefits fairs coming up in a couple weeks, so you can talk to an AVESIS rep directly. You'll see some rates listed here. And basically what this means, it's a voluntary plan. You may choose to sign up if you want. And for employee only, you would pay $60 a year out of your paycheck spread throughout the year. Then when you go in for an eye exam in network, it's just a $10 copay. When you get your frames and lenses, also those are available for $10 copays. Some places in network may actually allow you a $10 copay for both the frames and the lenses together. And there are also in-network providers that give you an even greater dollar allowance for your frames. Again, you can take a look at that network online. Instead of frames and lenses, of course, you can choose contacts, and there's a dollar allowance through the plan for that. You can definitely use other providers, and you'll see the reimbursement amounts there for you. Again, you'll just want to refer to any plan details. This gives you kind of the basic overview. Anything that you add on, such as a specialty lens or progressive lens or frames, those would still be covered. It just might cost you a little bit more. Also, LASIK discounts are available through the vision plan. The other new option this year for all benefits eligible employees includes any of our voluntary benefits through Colonial Life. These are basically income protection type plans. For example, we will have accident insurance, disability, and critical illness insurance, including cancer insurance. So what those mean is if you were to have an accident or you were to have a critical illness in your life, either one of those, you'd be able to submit claims and receive dollar payment back to you. And typically it would say, you know, for an accident, you might get dollar amount paid to you for a visit. You might get dollar amount paid for an x-ray, dollar amount paid for a hospital visit or a follow-up. Same for those critical illnesses. There's going to be a schedule of reimbursements basically back to you. Also through that is disability insurance. Now, the college already offers short-term disability. However, this can help you cover the gap. You can choose a disability insurance option that would kick in after only 7 days or only 14 days. And that would typically cover about 60% of your salary should you be ill and not able to work for that extended period of time. You don't see dollars listed on here because the rates are going to vary per person. So to explore the options for any of these plans, including the rates, what the rates would be for you, you'll need to meet with Colonial Life directly, and they will provide you a personal quote. So Colonial Life will be at all of the open enrollment benefits fairs coming up, as well as additional times during the remainder of open enrollment. So if you want to learn more about these plans, I encourage you to meet with a Colonial Life rep. Of course, we want to mention dental. We continue to offer these great plans. One option is through EDS, or Employers Dental Service. Great low-cost option with very small copay amounts and a fee schedule for all services. So this plan works that you have a booklet of fees for the different services you might need on the dental plan, so you would know exactly how much each service would cost. You must choose a primary care dentist on this plan, so you need to stay in network only to get all of these services. And it is important to note that it is an Arizona network. So if you have a family on your plan, maybe college students that live in another state, you want to keep that in mind, that their service would only be covered if they come home and use their primary care dentist. The other option, though, is our Delta Dental PPO plan. So this allows you to choose an in-network provider that's typically going to save you some money. Or you can choose any dentist that you want. So you can see your family dentist that you've been going to forever, and you'll basically pay a percentage of the cost. So for basic and preventive, you would pay 10%. For major services, you would pay 40%. That is after meeting a small deductible. Common question here is, well, how much does something cost? Because you only have a percentage amount, the best thing to do typically is to talk to your dentist and find out how much that would be, so you know then if you're paying a percentage what it is. The Delta Dental Plan does have a plan year maximum of $2,000 for an individual's services. So that means if you had a lot of expenses, once you've reached that plan year maximum of $2,000 and the plan had paid that much on your behalf, you would be responsible for the remaining cost. However, you'd still get that as a discount, but it is important to note. you'll see a note for enhanced dental implant benefits. So that was something additional added to the plan, and that kind of accounts for the small change in rates. So the rates for Delta Dental went up about 9%, but you get that additional benefit. The rates for EDS, however, have not changed at all. Again, both of these providers will be at the benefits fairs if you want to speak to them and have any additional questions. The college also offers to all employees, and this includes not just benefits eligible employees, but all employees throughout the college, a free employee assistance program. And that includes up to 6 in-person sessions with a local counselor for any type of issue. And that is per issue. So if you have stress at work and then 6 months later you have a family relationship issue, you could receive additional services. There are also a lot of great online tools, legal, wellness, financial services that are available through this provider, Jorgensen Brooks. The college continues to offer the same life insurance plan. So we have that 1.5 times salary available to all employees, and that is covered 100% by the college. However, you may also choose to add additional insurance for yourself and also choose to add insurance for your spouse or child. The college continues to offer a short-term disability, and for any employees enrolled under ASRS, long-term disability coverage continues. Now, with your life insurance, there are some special opportunities available at open enrollment. So typically when you're adding additional insurance, and also always if you're signing up for the first time throughout the year, you're going to be subject to evidence of insurability. That means really a medical questionnaire. However, if you currently have additional, or also known as optional, life insurance, you can add an additional $10,000 without the medical questionnaire as long as your total amount stays under $100,000. If you already have insurance for your spouse, you can add an additional $5,000 without that medical questionnaire as long as the spouse's total is under $25,000 and it does not exceed 50% of your total approved amount. So what that means basically is, as an employee, if you had $100,000 of optional life insurance, your spouse could have up to $50,000 of insurance, but not more than that with that rule. Any changes for life insurance should be made during open enrollment. It's also a good time to check your beneficiaries. So if you'd like to speak to any of the benefit staff or providers in person, please come to the open enrollment fairs. They are running April 17th through, the fairs themselves are April 19th through 21st, but your open enrollment dates, the times that you're actually going to either go online or submit paper forms to make changes, is April 17th through May 1st. All of the open enrollment benefits fairs, in addition to having all the providers, will also have health screenings available. Those are by appointment though, so you want to get on the intranet or check Pima News or the wellness update. Make sure you schedule an appointment if you're hoping to get a health screening there. So if you do want to make changes, you have 2 options. You can go online and use Banner self-service, or you can use the paper forms. So Banner self-service is an easy online way to make those changes, but it is a little bit tricky navigating through the system. So we encourage you to get a copy of the self-service guide that will walk you through step by step to make sure that you complete all the steps to make the changes that you want to make. Otherwise, those paper forms will be available on the intranet. Some very important notes. If you currently have a flexible spending account, and you want to have a flexible spending account again next year, you must re-elect it. You always have to re-enroll for that every year. If you currently have a health waiver, you also must resubmit or re-enroll every year to get those benefits. The health waiver benefits are staying exactly the same, but you must submit the paperwork. Otherwise, though, if there are no changes you want to make, you don't need to do anything, and all of your current coverage will automatically roll over. Remember, though, open enrollment is that specified window, so all changes must be completed by Monday, May 1st. So whether you're submitting a form or doing it online through Banner Self-Service, everything must be completed and submitted by that deadline. If you have any questions, I encourage you to, again, stop by one of the open enrollment fairs coming up in April, or contact the Employee Service Center. You can email the Employee Service Center at esc@pima.edu. You may also call the Employee Service Center at 206 or extension 4945. Again, remember, open enrollment is a limited time period, so you want to make sure you get all your questions answered before that deadline so you can make all the changes that you want to make. Thank you for participating in this presentation, and please see us if you have any additional questions. Thank you.